So your doctor just prescribed medication for your tinnitus. Here's what they probably didn't tell you. There is not a single FDA-approved drug for tinnitus, not one. So what exactly did they prescribe for you, and what does it actually do? I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah, and I've been treating tinnitus patients for more than 20 years, and I've seen just about every medication combination you can imagine. Today, I want to give you the truth about what these medications actually do and what actually works. First off, let's talk about the term off-label. That's what's happening when your doctor prescribes a medication for tinnitus. Off-label simply means the drug was approved for something else, but your doctor thinks it might help your tinnitus too. It's not illegal. Doctors do it all the time. But when a drug is off-label, there usually isn't strong proof it works for that condition. It wasn't designed for tinnitus. It wasn't tested for tinnitus. And the results are usually all over the place. The most common medication I see prescribed for tinnitus are antidepressants, older tricyclics like amitriptyline and nortriptyline, newer SSRIs like Zoloft or Paxil, or SNRIs like Cymbalta. Do they actually work? A major study on nortriptyline found something interesting. People did feel better. Their depression improved, their quality of life also improved, but the volume of their tinnitus didn't change. These medications are not turning down the volume of your tinnitus. They're helping you cope with the noise that's already there. One of my patients, I'm going to call him Mark, was not sleeping well and was starting to have panic attacks because of his tinnitus. His doctor started him on nortriptyline. 3 weeks later, I talked to Mark and he said the ringing is still there, but I'm sleeping okay. He finally could start doing the therapy we were trying to get him to do because he wasn't in crisis mode anymore. But there were some side effects, like daytime grogginess and dry mouth. Newer SSRIs and SNRIs often have fewer side effects, but you can still see nausea, sexual side effects, and some sleep issues. And some research suggests they may make it harder for your brain to adapt to tinnitus over time. For someone who's severely anxious or depressed, these medications can help, but they're a bridge, not a destination. If you're finding this helpful so far, hit that like button and subscribe. I put out evidence-based content on tinnitus every single week. Next, let's talk about benzodiazepines, Xanax, Klonopin, Ativan. I'll be direct. These medications concern me. Yes, they can help reduce how much you notice your tinnitus. They calm the anxiety, but they're addictive. Your body will build up tolerance, and withdrawal can be brutal. I had one patient who was prescribed Klonopin during a severe tinnitus spike. She felt great during the first week, but by week 3 it was wearing off, and she did not want to increase the dose. We worked with her doctor, tapered her safely down, and transitioned her to sound therapy and cognitive behavioral therapy. Most ENTs I work with only prescribe benzodiazepines for a week or two max. They're for crisis moments, not long-term use. And if you're on one right now, don't stop cold turkey. Talk to your doctor about a safe taper. What about other medications? Gabapentin, an anticonvulsant, was studied for tinnitus, but it did not outperform placebos. Memetine also didn't work. AM-101 didn't pan out. Steroids can help only if your tinnitus started suddenly with hearing loss. For chronic tinnitus, they don't seem to help. Supplements like ginkgo, zinc, and magnesium, unless you're actually deficient, the research just doesn't support them. So what is recommended? The American Academy of Otolaryngology says doctors should not routinely prescribe antidepressants, anticonvulsants, or anti-anxiety medications as primary treatments for tinnitus. Instead, the recommended treatments are cognitive behavioral therapy, hearing aids if you have hearing loss, and sound therapy. Medication can still help with the anxiety, depression, and sleep issues that come with tinnitus, just not the tinnitus itself. So let's talk about those things that actually help. Cognitive behavioral therapy does not make the sound disappear. It changes your reaction to it. Research shows significant reductions in distress, better sleep, and better quality of life with cognitive behavioral therapy. And with hearing aids, most people with tinnitus have some hearing loss. When we amplify the sounds you're missing, tinnitus often becomes much less noticeable. Modern hearing aids also include sound therapy tools. And speaking of sound therapy tool, white noise, nature sounds, customized sounds, these can reduce the contrast between your tinnitus and the environment, making the tinnitus less noticeable. And now there's Lanier, an FDA-approved device that combines sound in your ears with gentle tongue stimulation that retrains your brain to process tinnitus differently. We've been using Lanier in our office here in Utah, and we see meaningful results for patients who haven't responded to other treatments. Effective tinnitus treatment usually blends multiple approaches: hearing aids plus sound therapy plus cognitive behavioral therapy, or Lanier plus counseling and lifestyle changes. Everyone's situation is different, so we build a personalized plan for each one of our tinnitus patients. Yes, physicians prescribe medications for tinnitus, and sometimes they help, but usually only by treating the anxiety and depression around the tinnitus, not the tinnitus itself. Medication alone isn't enough. You need a full approach: cognitive behavioral therapy, sound therapy, and hearing aids if you have hearing loss. Lifestyle changes also help a lot. Medication is a supporting player. If you're currently on a medication, talk to your doctor before you change anything, especially if it's a benzodiazepine. If you'd like more tinnitus resources, I've got a free online learning center. And if you're in Utah and frustrated because nothing is working for your tinnitus, come see us. You can schedule an appointment online. Links are below. And if this was helpful, hit that thumbs up and subscribe. Remember, you're not alone. There is hope. Thanks for watching.